Welcome to episode 3 of Collecting My Observations. This episode was inspired by one of my old attendings at Rhode Island Hospital, Dr. Andy Maslow, coming to my fellowship training program to present a grand rounds for the anesthesia department. While he was at this hospital, he brought up a couple different points that I thought really echoed how I wanted to basically play out this year and hopefully play out the rest of my career. The funny thing about being a fellow is you're right in the crux of being a student and a teacher. And I think Dr. Maslow never left this crux, and he just sinks right into it and makes it look easy. So stay tuned to hear what I think it takes to position yourself best as both the student and the teacher.
Welcome to Collecting My Observations. Enter into the stream of thoughts that flow through the mind of an ICU fellow who is on his way to becoming an anesthesiologist and intensivist. This is where patients live on the verge of life and death.
This year of training, I've felt like I've been in the crux of being both a teacher and a student. There are times when residents are looking to me for the answers, and this has probably been one of the weirdest changes for me going from a resident to a fellow, where residents are asking you clinical questions regarding the patients that they're taking care of and are looking for you to make a decision, and you have to be confident enough in your decision-making skills that you're going to point them in the right direction, knowing that there are times in medicine where you may make the wrong call. But having that responsibility and knowing that you're the one that the team is looking towards is definitely something that takes some time to get used to. On the other hand, I have lectures Tuesday, Wednesday, Thursday, where we're basically learning newer material, but also, I guess, refining our knowledge base of what we had previously learned throughout our residency trainings. And so it's interesting to find yourself in this crux where you're expected to be proficient and knowledgeable in a field, but also are learning more about the field and learning how you can be a better ICU physician throughout your training. I suppose part of the job is learning on the job training, and like any internship, you learn more by just getting your hands dirty and getting involved in as many patients' clinical situations as you can, so that you can learn from firsthand experiences. And, the times where you make the wrong decisions, those are the stories that really stick in your head and lessons that you never really forget. As uncomfortable as this position is, I think this is the position I want to stay in for a large majority of my career. I think being somebody who is going to be looked towards for answers is just what being an attending is. But I think incorporating the mindset of being a student throughout my career is going to serve me well in becoming very proficient at my job and more trusting in my own skills and my own knowledge base that I'm making the right decisions and I'm leading my teams in the right path. So how am I going to accomplish that? Well, there's one person during my residency training who I think exemplified this really well. Now, if you've been listening to a lot of these podcasts that I've been putting out, and you happen to listen to the first season of Behind the Drapes, you'll remember this name, Dr. Andy Maslow. He was the season finale of the first season, where I interviewed him all about his career. But he's somebody who has really shown what it takes to be both a professor and a student. And I think that's what makes him such a good teacher, is he's always willing to learn new things and is always hungry for more knowledge. A couple weeks ago, I opened up my email and I saw our typical weekly email that showed us what the grand rounds presenter was going to be and what the topic was going to be on. And when I opened this email, the face that I saw was Andy Maslow's. And I was like, oh my God, he's coming to my fellowship program and is giving grand rounds. What a funny coincidence. And so when he showed up, he actually showed up, grand rounds on a Wednesday. He was giving a lecture Tuesday evening to the residents. So word got around to me, and then I sort of made myself available to go to that lecture. He basically got introduced by one of his, at the time, his residents when this person was a resident. Now they're a professor at the institution that I'm at. But he talked very highly about Andy Maslow and basically said he's one of the masters of anesthesiology. And Dr. Maslow, being the humble person who he is, basically had two things to explain why people think he is so knowledgeable in this clinical skill set. First, he said he knows normal really well. And by knowing what normal is, he's able to pick out abnormalities really well. The second thing that I noted that he said, and I don't think he really said this in any prophetic way or was intentionally trying to make himself sound smart in the situation, but the topic that he was presenting on was what happens to the body when you unclamp the aorta for aortic aneurysm repairs. At some point when he was giving this grand rounds talk, he said, 2 weeks ago I knew nothing about this topic, and now I know it in great detail. So let's start with that first statement. I know normal really well, which really helps me to pick out abnormalities. I think that's really crucial, especially in medicine. One of the first things I learned when I was in EMS was the ability to pick out when a patient looked sick versus not sick. And I think this is sort of that statement that Dr. Maslow said, but from a 500-foot view. Now, the more proficient you become in medicine and the closer you become to a physician at the bedside, the more detail you need to understand about normal anatomy, physiology, and then when things go wrong, the pathophysiology behind it. Question is, how do you get good at recognizing normal? Well, I think this comes not only from just reading textbooks and reading papers that come out about modern day medicine and evidence-based medicine. I think it really comes from evaluating your patients and not taking any of your physical exams for granted. And this doesn't just stop with the physical exams. This goes into vital signs and waveforms and really attention to detail. So just starting with the vital signs themselves, being able to realize when heart rates are appropriate, when rhythms are appropriate or inappropriate, when blood pressures don't look right, are you able to determine why they don't look right? You can get even more into the details when you start to add in invasive monitors like arterial lines, central venous pressures, pulmonary arterial catheters that are associated with different waveforms throughout the cardiac cycle. And being able to know what the normal waveform looks like really helps you figure out when those waveforms start to steer away from normalcy and start to look abnormal. In fact, this is classically how Dr. Maslow teaches the CVP pressure tracings. Now, electronic medical records make it pretty easy to tell you when lab values are normal or abnormal. Usually the abnormal numbers are going to be indicated by red fonts. But what really matters is stepping away from the computer and going to see your patients in person. For example, if you have a patient who's bleeding, it's really helpful when you go examine your patient to try and find the source of bleeding. Like if they're having an intra-abdominal bleed, you have to palpate their stomach to know that their belly is getting tense or distended, and that may be the source of where they're losing blood. Now, if you do a complete physical exam every time that you're examining a patient, majority of that physical exam is probably going to be normal. Most people usually have focused problems after you put out a lot of their initial problems. And so going through the full physical exam again helps reiterate what normal is for patients. And then when you focus on the active issues for the patients, that also helps you clue in on what's abnormal. At this rate in residency, I probably see about 20 new patients a week. That makes it about 80 patients a month. So I'll roughly end up close to seeing about 1,000 patients. And when you put the effort into taking close examination to every patient, that's potentially 1,000 opportunities to learn something new. Now, the next important thing that I think Dr. Maslow said was, I didn't know this information up until 2 weeks ago. And I think this really hits home the point of always being hungry and interested in finding out new information. I tend to use Peloton workout classes as my home gym for when I'm sort of rushed on time. They have great 20 and 30-minute classes. And one of the classic sayings that an instructor will say is, focus on your weaknesses and try and make them your strengths. And I think that's sort of what Dr. Maslow pushes himself to do with his knowledge base. And it's also kind of what I have naturally done with a lot of the social media stuff that I put out. Sometimes I try and find trendy topics that I think will get views or capture attention. But there are definitely other times where there are topics that I'm just not as comfortable with or not as sure about. And then it comes up clinically in my practice and I want to learn more about it. And then I take that opportunity to teach myself and then create content based on whatever that topic was. And so by putting yourself in positions where you know what your weaknesses are, know what your deficiencies are, and then try and work on them so that you can teach yourself, you're only going to set yourself up for improvement every time you do this. It's impossible to know everything in medicine, especially if you're at an academic center. There's going to be random patients who come in with strange symptoms, weird complaints, and a diagnosis that you were just not expecting or hadn't even seen before. But if you take the time to teach yourself and learn new things, you'll only get better at this job. And the next time it comes around, you'll be ready and prepared to treat that patient and give them the best possible shot. So those are really my two biggest points that I hope to just incorporate throughout my career. The ability to understand normal really well and hopefully incorporate that into my teaching residents and potentially even fellows in my future, of having them keen in on details and really understand why the anatomy and the physiology makes sense for normal, so that when it comes to explaining and understanding pathology or the abnormal events of anatomy and physiology, they're able to understand that to a better depth. And secondly, I hope that I'm able to keep this thirst for knowledge up, and when I identify deficiencies or weaknesses in my knowledge base or clinical practices, I have the humility and the interest to try and improve on it and seek out the information to make myself more knowledgeable, hopefully use it as an opportunity to teach somebody else. Because if I've learned anything this past couple of years that I've been doing this teaching stuff, it's that I definitely feel like I understand this material so much better when I'm forced to paraphrase and teach it and consolidate it while making it still make sense and be thorough enough that somebody can use this information for the benefit of their patients. So really, mastery comes when you become a teacher. Being the son of a teacher, my mom's a teacher, my wife's a teacher, I can truly appreciate the passion and energy and skill set that goes behind being a great teacher. So cheers to them. If you like this episode of CMO, be sure to hit the subscribe button to the Behind the Drapes podcast, where you can hear more episodes just like this and have the new episodes downloaded to your homepage as they come out. If you want to check out some of the educational content that I put out, check out my social media page on Instagram and TikTok and YouTube, and that's at Keywords by Kenny, at Keywords X Kenny, and that'll get you to these short videos that I put out about different educational topics related to anesthesia and the ICU.